I ended up being an immigrant, moving to the country. I was sleeping on an inflatable mattress. I had a Coke crate as a side bed. And so looking back at that to the point where I then just most recently served at the White House, that can only be true in part because of the opportunities that are given to us. If cancer takes more people's lives than HIV, TB, and malaria combined, and we know that cancer rates are only increasing, particularly in low and middle income countries, what is stopping us from having something similar? I know the answers now. It's because it's really complex and complicated.
Can you share a real-world example of when you had to push through some institutional or governmental red tape in order to get something to happen?
Yeah, I mean, all the time.
Yesterday, the day before. Today's guest is a true rock star in global health and systems innovation. Dr. Catharine Young is a senior fellow at Harvard and a leader who has shaped national and international cancer strategy, driven rare cancer research, strengthened global biosecurity, and built high-impact partnerships across government, science, and industry. Born in South Africa and fueled by a relentless commitment to health equity, she now is spearheading the creation of a bold global cancer fund aimed at transforming access to early cancer diagnosis and treatment worldwide. I love the stories that she tells about her journey to the White House, about her collaboration in the Quad working on global impact on cancer. So, welcome to the Badass Leaders Podcast. I'm your host, Angela Gill Nelms, and each week I sit down with leaders, founders, and change makers who refuse to play small. People pushing limits in their careers, companies, and lives. If you're ready to dive into that kind of purpose-driven work, then let's get started. Well, Catharine, welcome to one of our episodes in season 2 of the Badass Leaders Podcast, where we're focusing on badass humans. I've read all about you, and I definitely know that you and the work that you're doing fall within that category. So I want to get started by allowing you to introduce yourself to the audience. And so as we mentioned, before we go into those badass things you've done in your career, please start with talking about who you are as a human. So who is Catharine Young? What shaped you? And what's the story that brought you to this moment?
Amazing. Well, thank you so much for this opportunity and to be able to tell my story. So I am a scientist by training. I have a PhD in biomedical sciences and did postdoctorate work in biomedical engineering and have always had a love and devotion for science in general. So my entire really career and life as it is has always had some sort of scientific piece to it, although that has looked very different over time. The second piece to what has been a really powerful force of shaping me in my life is that I am also an immigrant. I immigrated to the United States when I was 18 with my parents. We immigrated from South Africa, which at the time had just gone through a humanitarian crisis known as apartheid. And I had lived through that as a child, and really, grew through a system whereby the color of my skin, essentially enabled, my well-being and put me ahead of so many others in the country. And I think by moving to the United States at that pivotal time of being 18 really forced me to be able to look back in terms of what I grew up through, and has really been a defining motivation from that point on to ensure that whatever I do, that it tries to equalize systems as best as possible. And I think the ability for executing around equity and access, particularly in my world, which is the cancer world right now, has always had a really big part in that. And I think as I've reflected over the years and had many questions asked about my journey, I think I can see very clearly how that has been a very defining part on who I am and why I do the work that I do today.
That is so powerful. And I work with a lot of colleagues that do a lot of cancer research. So I'm super
Mm,
excited to hear more about the work that you're doing. But
yes,
first, as you mentioned, you've moved across countries
yes,
and industries, and you've had quite a few high stake roles.
yeah.
What part of your identity as an immigrant, as a scientist, as a woman in science and technology, or STEM, has influenced you in the way that you lead today?
Well, I think all the parts, including, I would say first and foremost, being a woman navigating these worlds, which are oftentimes very difficult. I think women in general come across barriers and challenges that men don't. And I think I have learned many lessons from that and really shaped the way that I lead based on many of those lessons that I've learned, particularly in terms of how do we show up and support others in their roles and make sure, again, to that point of creating equal grounds for everybody. I'm also a mom, so I have an 11-year-old daughter, and I always think about what am I doing to create a better world for her. She's always in the forefront of my mind as we kind of navigate this really challenging world that we live in. And it seems like day by day it gets more and more challenging. Doing whatever I can to make sure that I am paving a path forward for her so that maybe she doesn't have to go through the same struggles that we have had to have gone through, much like we are standing on the shoulders of so many women in our past. Of course, as I mentioned, being an immigrant is so incredibly self-defining for me. Not in that, I look for sympathy or empathy based on that, but just how, in a big way, I recognize that moving to the United States has afforded so many opportunities that I would not have gotten before, that it really motivates. It's a very powerful motivator to make sure that I give back to this country as well, in terms of what it has given me. I mean, I ended up being, an immigrant moving to the country. I remember when my parents and I first moved, we were staying in a two-bedroom apartment. I was sleeping on an inflatable mattress. I had a Coke crate as a side bed. And so looking back at that to the point where I then just most recently served at the White House, there is a very there that can only be true in part because of the opportunities that are given to us in this country. And so for me, in terms of leadership, what I think about is how do I make sure we're continuing to give back to this country the way it has given so many of us these amazing opportunities as well.
So well said. And I will just say I work and collaborate with a lot of first generation immigrants.
Mm,
And there is something that's very powerful about the grit, the resilience, the determination, this internal fight to be the best that you can be and to take advantage of every opportunity that oftentimes I see a lot of other individuals take for granted. So I
right.
love you sharing that piece of it. Let's dig a little bit into your work because, as you mentioned, you recently served in the White House, and I know a little bit about the work that you did. But let's talk a little bit about that journey. How did you get
Mm,
there,
mhm.
and why have you become so passionate about cancer and the work that you do today? And maybe perhaps share a little bit about the cancer work that you did
Yeah,
in the White House that you were able to share.
absolutely. I've just I feel I've been so lucky in my career. Part of my stepping stones have been very serendipitous in a way. I've never been the type of person to kind of map out what my career journey was going to look like. Whereas I know there are many people who are so focused and so organized in how they kind of maneuver through their career journey. I've always been in awe of that because I just have never had that. But I think it has allowed me the opportunity to really kind of take these opportunities that sometimes cross your path in a very organic way to go, oh, I've always been open to these new opportunities. So as you mentioned in the beginning, I've kind of maneuvered through different sectors, including working at the Department of Defense, working for a foreign government. I served as a science advisor for the British Embassy and the UK ambassador. And then my entryway into cancer came when at the end of the Obama-Biden administration, the very last year of that administration, President Obama handed to Vice President Biden at the time, an initiative to take forward, which was called the Cancer Moonshot. At that time, it was to double the rate of progress around cancer because his son had been recently diagnosed with glioblastoma, which is a very rare and aggressive cancer. And so that was the very last year of that administration. When back then Vice President Biden left the administration, he started a nonprofit called the Biden Cancer Initiative, which was to really continue a lot of that work going forward, but now in the private sector, not the public sector. And I was hired there as their senior director for science policy, which was my entryway to really I'd always been very high level science, and this was my first opportunity to get really granular in a particular focus area, which I loved the idea of doing that. And then when Vice President Biden decided to run for office as president, we shut down our operations because he was entering into the campaign trail. And I became the executive director of a rare cancer organization to really try and push forward solutions for a very typically neglected patient population group. He had always said that should he become president again, he would bring the Cancer Moonshot back into the White House. And he was very true to his word and was very, very fortunate to have been brought back as part of that team. Our mission for that part, this kind of Cancer Moonshot 2.0, was to reduce the cancer death rate here in the United States by half over the next 25 years. So a very kind of national/domestic focused program. Although my role specifically evolved over time to think about how do we take the mission of the Cancer Moonshot globally. And so I started to work more at the country level, bringing countries together to say, we know that working together around these things that really affect all countries has a much more powerful way to provide solutions for everyone than if we were all working in our siloed ways. And so I was able to work with a number of initiatives and countries, specifically in sub-Saharan Africa, and then also India, Australia, and Japan as kind of the countries we engaged with the most during that time. But it was just this incredible experience of really thinking through what are the gaps, and then also how do we come together to work towards filling those gaps, because we know that we're so much stronger when we're working together, especially when it comes to global collaboration. And we were able to make really great progress that way. And that was basically the work I did back then.
That's amazing. Do you have any stories that you can share from maybe collaborating with some of those countries? Maybe one piece, is there something that really surprised you when you were doing it that you didn't expect from the particular country or culture, or something that you took away as like an impactful life lesson to you?
Yeah, it was so interesting. So I'll give the example of an initiative we launched with the president and the prime ministers of India, Australia, and Japan, which was called the Quad Cancer Moonshot. So these 4 countries together were affectionately known as the Quad. And we had come together to kind of investigate where are the opportunities that we could potentially work together. And the deciding point was we would work to tackle cervical cancer, which is a very prominent cancer in the Indo-Pacific region. And we would want to try and make as much progress in the Indo-Pacific as we possibly could by having these 4 countries come together to pool their resources and their commitments together. what was really interesting is that each country kind of looked at cervical cancer in a very different way in terms of how they could possibly contribute to these efforts. So Japan was very kind of data focused. Australia has done a ton of work around cervical cancer. So they knew like on the ground how to execute some of these programs. And then also because Australia is so diverse and so large, they're so good at thinking through like how do we reach people in the very rural areas where it's not easy to get access to HPV vaccines and other really great tools that we have to kind of conquer cervical cancer. And then India had just started to create their own vaccine. So then we were like, oh, we could use that and use it for the region as well. So it was this really fascinating experience seeing how these countries evolved in their thinking and what they could bring to the table, which was so different from each country themselves, which was really amazing because you start to realize that one of the powerful things about working together is everybody's bringing in a different piece of the puzzle. And so instead of just, the United States bulldozing forward or Australia taking their efforts and wanting to, maybe use that as a model, we're all kind of coming together and saying, okay, how do we collectively put this together in a comprehensive strategy so that we can then, hopefully accelerate progress even that much more quicker and further. So it was just this really amazing experience because everybody was so committed to making sure that they were bringing something substantial to the table and they did.
I think so many people don't realize that different cultures, different communities, different countries, different individuals see the same problem and the approach to solving that problem in different ways. And when you can get into a collaboration and allow people to then express how they see the problem and how they potentially see the solution and figure out something that is monumentally better together like that, that is really big. Okay, so now I want to know if when you, Catharine, were a little girl, I'm guessing because you said you did not dream this is what you're going to be. I'm guessing I know the part of this answer, right? So, but I'm going to ask the question anyways. Is this what you wanted to be when you were a little girl? And if not, what did you dream of back then, and how similar or disaligned are those two things now?
Well, first of all, to answer that question, a resounding no. Would never, ever in a million years have even imagined this possibility, right? Like just never imagined it. I have an older brother. He is 7 years older than me and just the smartest person that I know. And so I was always trying to, in my own way, keep up with him. And he took all the sciences. He was excellent at math. And so he was really the first role model I had to try and keep up with in the sciences, even though he was so far ahead of me. And so I think I always knew kind of deep down that the science pathway was always going to be at the core of what I did. I just, even at that time in high school, had no concept of how that would eventually settle out to be. And quite to be honest, like even a year ago when we were post-election and recognizing that we were going to be leaving the administration and this work too, that, a full year from then, I probably wouldn't have even known what I would be doing now, right? So it's like, I think one of the greatest maybe curses and the greatest blessings of life in general is that we just don't know what's coming down our pathway. And for me, the key has always been to try and be as open to possibilities that I don't negate things along the way just because I feel like I need to be tracking down a certain path. So I think that's been very helpful for me in general.
No, I love that. I think too is that I can tell through the stream of the work that you've done, you've stuck to the core of who you are, which is bold and brave and passionate. I think that a lot of people have the wrong impression when we say personal branding, that when we work, for example, with clients on how to identify and really amplify their personal brand. It's meant to do it in a very authentic way. We do a lot of work really in the psychology behind someone to figure out what their voice is, what their personality is at the core. And the things that I've read about you, and now I'm learning about you in this conversation, I think that's been such a solid common thread through the work that you've done in the different areas. And I think that that's really, really important in your story in particular.
Well, thank you for that. I think, if you had asked me even a year ago to define what those core values or pieces are, I probably would have struggled to put words to it. But I think, especially this past year of, since leaving the White House and really having to define a new path forward, it's also created this new opportunity to think very carefully about, okay, how have I traversed this world? And what is important to me? Because if you become very clear on those pieces, it's suddenly making decisions about your life and your career and even in your day-to-day job becomes very easy because you have kind of this North Star that you're reaching towards. And I think kind of the words that you just mentioned, I definitely resonate with. I do feel that that is like a part of my story, but it has only been till recently that I've really started to crystallize that in a way that I can put words to what it is that I've done and hopefully will continue to do as well.
Well, let's dig a little bit more into that because, as you mentioned, in the past year and several months, a lot has changed. And hence, as you mentioned, you've transitioned into a new type of role as that initiative was moved out of the White House. Can you tell us a little bit about that transition? What are you
Yeah.
working on now? What are you super excited about?
Yeah. So I'm very excited about this work. I'll give you a little bit of background in terms of how this kind of concept came about and where we've come from and where we are today. So before the election happened, so because my role was kind of this global forward-thinking role, we started to ask the question, what would be that one thing if we had another 4 more years in the White House that if we were able to achieve during that time, we could make catalytic change in low and middle income countries when it comes to reducing that cancer care gap that we have between LMICs and more wealthy nations like the United States. We know that 70% of all cancer deaths actually occur in low and middle income countries because they just don't have the access to the tools and the resources and the knowledge that we are so lucky to have here in the United States and in other high income countries. And so we started to convene the experts around the world and ask them this question. And the one thing that kept on coming to the surface was this idea of a global cancer fund. So what this is really kind of mobilizing funding towards a certain, focus for low and middle income countries. And we used the example of the Global Fund, which has been around since about 2002. It was initiated in the George W. Bush administration and focused on creating a very dedicated financing mechanism for HIV, TB, and malaria. And since its inception, has saved over 70 million lives in low and middle income countries. So we know that when you are, and it makes so much sense, right? It's like,
Yes,
duh, you put money
absolutely.
behind it. Of course you're going to save lives. Like, it's such a no-brainer, right?
Yep,
The question that
absolutely.
kept on being asked was like, okay, if cancer takes more people's lives than HIV, TB, and malaria combined, and we know that cancer rates are only increasing, particularly in low and middle income countries, why don't we have something similar? Like, what is stopping us from having something similar? I know the answers now. It's because it's really complex and complicated. But the question is still like, we should absolutely be doing something about this. So back then, about a year ago, we were like, okay, well, we have the thing that we're going to focus on because it was really a unanimous cry from the global cancer community. Of course, then the elections happened and we were like, oh, we don't have 4 more years. But what happened was a core group of cancer organizations and others, like the World Health Organization, the World Bank, came together and said, we believe in this and we want to see this continue beyond the administration. We don't want it to just come to the cliff and then drop off, right? Because we had started to make progress already in terms of what it might look like, what might we focus on, and kind of that blueprint aspect. And so I was very lucky enough to be brought on to kind of lead this effort going forward on behalf of this coalition of organizations, to figure out, okay, well, we know this is a good idea. We know that the cancer community wants this. The question now becomes, how do we do it? And so that has been my role over, I'd say, about the last 8 or 9 months, is to figure out, first of all, what would we focus on? And we spent a lot of time working with the global cancer community and asking them what would be that one thing that would be catalytic. Turns out it's really difficult for consensus. When you think about the
Yes.
global cancer community, everyone's bringing in their own, this is a really important piece and I really want this to be the focus. So
Right.
for me, when we got to consensus around the what, I was like, is my job done? Because I think we've just made really great progress here. But then I realized we had the whole financing piece to figure out too. But what we figured out was, or where we landed in terms of consensus was, the focus would be preventing or catching cancer earlier. It's called stage shifting. If we can shift the stage 3 and 4 diagnoses to a stage 1 and 2, we would do two things. One is that we would release the financial burden on the healthcare system as a whole, because all of a sudden, instead of having these long-term diagnoses, which are really complicated to care for, you now have an opportunity to, maybe there are treatments available already, but we know that the sooner you're able to diagnose somebody with cancer, the better their chances of survival are. And so the second part is, by doing this, we're able to really give people the opportunity to live their full lives, to live to their full potential, right? And that's really what we're working towards here. So catching cancer earlier, or stage shifting, is the focus. And if we were to go one step further than that, it would be to focus first on cervical and breast cancers for women. So this is just a starting point, but the reason why these two were raised is two reasons. One is that there are already a number of kind of international and global frameworks out there that so much work has been put in already in terms of how do we tackle these diseases, that we're not starting from zero with this.
Oh, yeah.
And
I
then
love this.
and then the second piece is, when it comes to something like cervical cancer, I mentioned before the Global Fund, which tackles HIV, TB, and malaria. There is this huge intersection between women who are diagnosed with HIV. They are 6 times more likely to also at some point be diagnosed with cervical cancer. So there's this overlap of these two kind of diseases together. If we can build upon the infrastructure that already exists for treating women with HIV, but on top of that, amplify support for screening for cervical cancer, or providing HPV vaccines, which we know prevent cervical cancer, we're again not starting from a baseline, but instead we're building on top of already built infrastructure that is making great progress in terms of engaging with these communities and bringing women into the clinic. And then the breast cancer piece, it's like, okay, we don't want to look at women just as an organ, right? We don't want to be like, we will only see you because we want to be able to screen for cervical cancer. If we're able to engage with women, screen them for cervical cancer, why not screen for breast cancer at the same time? We're there, right? We can do that. And
Right,
that's
right.
That's been, shown time and time again. So that's the launching point. That's the starting point of this work. We would, of course, move on to other high burden cancers in other regions as well. But we have to start somewhere, and we don't want to overwhelm, be like, we're going to cure all cancers, right? That's just not realistic. So these are the areas that we know will have the greatest chance for impact when it comes to low and middle income countries. And now that we have this really kind of set in the foundation of our work, we are now pivoting towards, okay, how are we going to execute on the financing piece? Because all of a sudden we're entering this world in a totally different world than it was even a year ago. The United States has significantly pulled back in terms of their
Yes.
funding and focus on global health. And so people are like, well, okay, this is not the best time to be starting a whole new financing mechanism for something when people are already scrambling for funding. And so the way that we're thinking about this is like, you're right. Like, we don't want to come in as another siloed fund. And we don't want to come in and be like, oh, we're the new kids on the block, so we're going to start taking funding wherever we can get it, which means that we will probably be taking funding from those that are already doing excellent work in this way. So we don't want to come in and duplicate or compete for funding. We want to be able to, and I think this is where the innovation lies, look at the creative ways that we can tap into pockets of money that already exist, but haven't necessarily been used for global health before. Because this way, we're adding to the money. We're not taking it away from other efforts and other organizations and other funding initiatives already. And so if it's okay, I'll give an example of what that
I
might
love
look
this. Yeah.
So,
But real quick, I want to say,
yeah.
a thing that I love about this journey, I was interviewing someone yesterday for a very different topic. We were talking about sales teams and management and marketing.
Yes.
And we were talking about companies when they're setting up their sales teams, looking at strategy, processes, and people. And I love about this journey you're walking us through, because it's very evident that you started with the strategy, right? We're going to build on top of something that has some momentum so we can amplify that momentum. And then the process is next, like, okay, we don't want to take away and inhibit the work that's being done. We want to figure out ways or things that are maybe missing that can help out. And I'm sure at some point, then you'll get to the people, like who are the people you need to bring in for this collaboration to be successful. So I want to hear your example, but I wanted to share, I love thinking through that process with you and hearing your journey, because it's just a lesson in how teams can successfully collaborate together towards a shared mission.
That's such a good point. And I think one of the most powerful things about this work is that it is bringing together organizations that haven't necessarily worked or been at the same table before. In a way, they're slightly competitive in what they do, but this kind of idea of really creating something that we know is needed and almost like a moral obligation for us to do, it all of a sudden lessens the barriers for everybody to want to be a part of it, particularly in this timing where people are really looking to hold on to things that give them hope for the future. That building something like this, I think, is providing people that opportunity to be like, oh, this is something really good in a time that we feel is, we've seen a lot of systems being broken down, and here we are thinking through how do we build a new system that can survive, not just this year or next year, but many, many years from now. So it's a very, very exciting and powerful model to be able to, think through as well.
Absolutely. Let's dig into the example you're going to share.
Okay. So when we think about being really creative, the one thing that we were thinking about is like, okay, we need to tap into the money that already exists, that's flowing between, say, the United States and Africa, for example. We know money's out there, right? Everybody keeps on saying the money's there. You just got to find ways to get it. And so that always infuriates me, because I'm like, well, that's really hard to like figure out.
Yes.
It's really infuriating when people say, but the money's out there. You just gotta get it. So we've spent a lot of time thinking about this. And there are communities, both say here in the United States and Europe and other more wealthy nations, that are made up of individuals that lived or were born and raised in, say, Africa, for example. We'll use Africa as an example. And then they immigrate to the United States. They called it the diaspora. They were born somewhere and now they live here in the United States, but they often feel still very connected back home, or they have family members who still live back home. And so what they do is they end up sending money back home, and they send this money in the form of what is called a remittance. And there are many digital organizations that help individuals send money back directly to their family members. And this, is helpful for family members to be able to pay for schooling, pay for healthcare, pay for, whatever their needs are at that time. So
Absolutely.
turns out that the diaspora here in the United States sends back over $100 billion every year to Africa. That is an enormous funding stream that is flowing between the United States and Africa. In fact, globally, that number is 660 billion. It is more than any foreign aid combined, this amount of money that's moving. And so our goal is actually to tap into that funding stream, even by 1%, because if you could imagine, if we tap into 1% of that money, that's $1 billion per year in perpetuity, right? Because that money is never going anywhere. It's never going to stop.
Right. Right.
And
Exactly.
our goal that we put out in the very beginning for the finance piece was that we wanted to mobilize 1 billion by the year 2030 and have that be a sustainable amount of money every year. So it's not just like, let's get 1 billion out to low and middle income countries. This is the idea is that this will be a sustainable amount of money every year. And so if we capture that 1%, we already meet that $1 billion goal by 2030. And so actually in a week's time, we're headed to Uganda. Uganda has stepped forward as the first country, the government of the first country, to say, we want to figure this out with you. And can
this
we
is exciting.
Yeah, so can we figure out what this blueprint looks like and then scale it to other countries who are just as willing to want to be a part of this? And the really great thing about the way that I think about this is that these are people who are already sending money to a country they care deeply about. The money, or the 1% that we capture, would go directly to that country. We would work with the governments and the healthcare workers in terms of what the needs are. And what this allows us to do is be able to say, look, here, you contributed a small amount of money, and this is the outcome of that, right? So a big part of what we want to do is build a platform in which we can use 21st century technology that hasn't been used for global health yet, say like blockchain technology, to be able to track the money coming in and the money coming out and how that's attached to changes in health outcomes in that country, so that somebody can go to a dashboard and be like, oh my goodness, my, however much money I sent is going towards building a new, healthcare center or a new hospital in Uganda, which ultimately will not only help my family members in the future, but really the entire country, right? So to me, I just see this as like a total win-win model, and we'll be going to Uganda to figure out this blueprint, with the hopes that we'll be able to, scale this so that we're able to reach that 1 billion by 2030.
And this is amazing because really, if I'm understanding this correctly, to me, one of the beautiful pieces of this is the money is coming from people, for example, let's just say in the US, who are from those countries and have family in those countries. And so they are opting, hey, I'm going to support the improvement of this country that I'm from, and I'm going to direct pieces of my resources directly to that. And by doing that, oh, by the way, I'm also helping global health in this area, because when we start seeing the successes let's just say in Uganda, there are going to be many lessons learned and
Absolutely.
successes that can be spread across the other areas. I do want to go back and just for the listeners, I think a lot of people now understand the difference between stage 1 cancer and stage 4 cancer. And I think the general public often thinks, okay, stage 4 basically means you're going to die and stage 1 is super low risk. But I really want to tie into, stage 4 means at this stage it's spread throughout your body. And so it's impacting multiple organs of sorts, right? And so hence the impact of that and your ability to heal and recover and live a full life from that and the medical cost of that is so
Yeah,
astronomical.
astronaut.
Versus when you said stage shifting, so moving it back to where we're capturing it at, let's just say stage 1, where it's isolated and that individual perhaps can have a surgery to have it removed or have very targeted radiation or something like that. Like that difference when you take a step back and then let's go back to what we're talking about, right? In an area like Uganda, which I can imagine they're not constantly getting screening for these things. So they're
No,
more likely to not be found out until they're
absolutely.
3
That's
and
exactly right.
4.
That's
So
exactly
just
right.
being able to do this in an area and then also people in the United States forget there are a lot of rural areas in the US where people
Yes.
do not have access to
100.
health care. And
Yes.
we can anything we learn in those areas about how to provide easier access in modalities that people can reach to, we can also utilize in the US as well.
100%. I mean, do you want to come work on my team? Because you're like, you have this like so figured out. No, that's exactly right. And I think it is one of the biggest misconceptions is that, oh, if you get diagnosed with cancer here in the United States, you'll be fine. That we're the wealthiest country. We have the best doctors. We have the best resources. And yes, that is true. But for those who live in rural areas who are not getting screened, who have to travel many, many miles to a healthcare center that, don't have access to the things that the big cities have access to, or quite frankly, the financing to go to a big city to be treated, they suffer from the very, very things that low and middle income countries do too. And that is just the lack of access to resources, tools, and technologies that the biggest cities already have access to. So 100%, this is a bi-directional learning process whereby what we learn in these areas we can absolutely bring back and help support those here in the United States in the rural areas as well.
Okay, this is so exciting. So let's get back to just a little bit back to you though, Catherine. Okay, so as we're talking about this and I'm thinking about this, we're hearing about the impact you've made in the White House. You mentioned earlier about the Department of Defense. And of course, right now, we're talking about global cancer initiatives. So I want you to pause for a moment and look back. Was there a particular moment when you, Catherine, realized, hey, I'm built for bold systemic impact, not just like another cog in the machine? Because there's nothing wrong with doing, being a piece
No.
of a machine and that, but you said, no. My legacy is going to be, I'm going to make a huge impact. So was there a moment, a shift that you knew that's what you were built for?
Honestly, no. It's come out by the choices I've made with my career, in my different kind of stepping stones in my career. I think if I had to go back and pinpoint a specific time, it would be kind of the transition between my training as a scientist and being in academia and then stepping out of that into the world of policy. And I think for me, looking back in terms of what drove that decision was that while I love science and I loved, the idea of finding new things that contributed to the knowledge of our world, I was frustrated with the fact that oftentimes those findings, they are part of a much bigger picture that takes many years to decades to fully understand, in terms of how that's translated to health for individuals. And this wasn't a conscious thing, but I look back and I can see that that was what the motivation was, is that I wanted to be part of systems that helped change things much quicker for patients and individuals, whether that was, in the healthcare world or the scientific world. And so I have always, and since that time, have always been in these positions of looking at how do we change systems, right? Not at the individual basis, but when we look at it in totality, where are the problems and what are those things that we can come in and say, oh, with a change of policy, we can unblock this and that will result to this, right? Or if we change the structure of something, it might be able to help us do things efficiently and work faster, or whatever the case may be. I think I've always, always, always been drawn to kind of the bigger picture kind of systems approach versus, what does this particular protein that I've been studying for many, many years do? And how does that fit into, the cell that I'm studying? It's just on a bigger scale, basically, that I'm trying to operate on and looking back at my career, I can see that has always been this kind of thread.
Okay. So when we're thinking about this, and I understand a piece of what I'm about to say a lot more now than I did a year ago as well, because I want to talk about when you're working to make a change and an impact.
Yeah.
And so you have the urgency to do that. However, you're working with governments. So you're in this mix of urgency meets bureaucracy, which I understand now because I'm doing advances in medical technologies at university systems. So I am in the middle of lots of bureaucracy. So can you share, thinking about this, can you share like a real world example of when you had to push through some institutional or governmental red tape in order to get something to happen?
Yeah, I mean, all the time.
Yesterday, the day before.
Listen, these like the big organizations, our academic institutions, the government, big advocacy organizations, it doesn't matter what it is. Whenever you get to a very large size, it will often be just bogged down with bureaucracy and procedures, right? One of the frustrating things for any of us who are trying to, impart impact in a very urgent way is always coming up to these pieces that throw up roadblocks that don't seem to make sense, right? Like, it's like, well, why do we have to wait this long for a decision? Like, that doesn't make any sense. And so the part of my role I see is always pushing back on those pieces all the time to be like, how do we change this piece to make it not so difficult for others as well? And so I think I kind of envelop that in kind of my day-to-day world as well, because and it's helpful now that I'm a little further on in my career, right? Not everyone's going to be able to push back and have an impact, but I think those of us who are far enough in our careers who have the opportunity to start asking questions about why things are done the way they are, in not an accusatory way, but certainly trying to understand and or improve the processes. I think we have an obligation for that. It continues to be a very frustrating thing because in my mind, I'm like, there's no reason for us to be doing it this way or to be moving so slow or to have all these these processes in place. And so I think in a way, this is why leadership at the highest levels matter, because those are the people that can really start to make significant changes within the organization, but it does require them to understand how that organization operates from a very basic level, from the very bottom up. And so those individuals, when they come in and can start to make significant changes that way, are just shining lights in our world, because that's really what it takes to start seeing change in that happen.
I love this. And I think when I hear, especially this year, when I hear people say that they're afraid to come in and try and have a bold voice, or they're afraid to, for example, invest money in cancer treatment, because I actually see it as an investment in the treatment. It's an investment in humanity. It's the investment in our future generations and in those people. When I hear, for example, VCs and funding partners holding money close to their chest, and I talk to other people, I say, look, you may think now's not the time, but actually, there are really so few people actually stepping up that if you really want to make an impact, now is your time to make an impact and build a legacy and leave behind something that you are really proud of. Now, there could not be a better time to do that than now.
I couldn't agree more with you. I'm always like, do you want to look back a year, 2 years, 10 years down the road and just see that you just flatlined and kind of went with the status quo? Or do you want to look back and say, that was kind of a bold decision at the time, but oh my gosh, the impact that that had was unbelievable. I mean, I am starting to feel like I think internally this intolerance of organizations and individuals not stepping up and wanting to
Yes.
do the right. I'm like, I don't understand it. And because of that, it's getting more and more embedded in me to push forward harder. And so, yeah, no, I totally agree with that. I think the world needs more individuals, especially to kind of step forward and be like, you know what? Yeah, it's hard and it's challenging. And yes, the environment in which we operate is not so kind to us all the time. But if we continue to choose pathways that provide us a comfortable way forward because we don't want to feel uncomfortable, then we're never going to make progress. And I think that is probably the biggest lesson that I've learned in the past year.
Agreed. Okay. So thinking about global health in general, from your perspective, Catherine, what's one misconception that leaders often have about global health, innovation, or policy that drives you absolutely crazy? Aside from
Yeah.
what we just talked about, which I can tell we're both like in sync with
Yeah,
that driving us
totally.
insane. But aside from that, what's one misconception that drives you crazy that you would like the world to kind of debunk?
Yes. The fact that many organizations or individuals that live in higher income countries, let's take the United States as an example, often believe that they think they have the answers to the solutions for low and middle income countries, right? If we come in and we just do it this way, all the problems will be solved. When in reality, those who live that reality are the ones that have the solutions to that problem because they understand it completely. And so there's this, not all, and I will say it is changing, but this kind of historical approach that we've used as the United States to come in and be like, this is how you should be doing it, right? When in reality,
Yes.
what we should be doing is working hand in hand with those on the ground to understand what are they experiencing and how do they think things should change to make the solution better. And once you start incorporating their voices and their solutions, then you start to see change happen. It is not us coming in to tell them what to do. It has to be a partnership. Yes, we want to come in and help, but we also need to understand it from their perspective, because from our perspective, the lens that we're seeing the world is so different, and it is oftentimes not providing the right solutions for those problems. So, I think we're learning as a country in many ways that this is the approach that absolutely has to be done. It's kind of taken a little bit of time, but we're definitely getting much better at it. But I think we need to do an even better job at making sure we're including the voices on the ground.
I agree. And oftentimes, what I think that means is that we need to get out of our comfort zone, go into those countries, visit those rural areas, and visit them with this perspective of curiosity
Absolutely.
and of asking questions, asking them, hey, what do you feel is working now? What do you
Yep.
want to make sure as we collaborate we don't screw up? And what's not working? What's some crazy idea that you have, right? But go in with a spirit of curiosity to learn more in the cultures, have some feet on the ground, talk to humans as humans, and then come together and have a mutual conversation where it's not
Yeah,
like a parent talking to their kid, which is
absolutely.
really the way I see it a lot of times when I not just in this, but even in business, right? When we have
For
someone come
sure.
in, the
Yes.
exact same thing, right?
100%.
Instead, curiosity and dig in. Okay, so this is hard work. I mean, I know working in cancer is there are days when something great happens and you think, I'm so glad I do what I do. And then there are days when something not so great happens and you
Yeah.
think, wait, why am I doing this? So can you tell of, either an experience or something that you reflect on or that you do that really helps to fuel you on those days when you want to quit?
I think I have, come through so many difficult challenges that the way that I work through really hard days or periods of time is recognizing that everything is transient. It is not permanent. The day is not permanent. The hour is not permanent. The particular challenge that you're facing will not be permanent. We will eventually get through it. And yes, like there are days where you are like, I don't actually know how I'm going to get through today, nor tomorrow, right? But like,
Yes,
if you're
yes.
able to come to these problems with this mindset of, yes, it's hard, but it's not permanent. And there will be a day when things will be better and brighter and something great will happen to remind you of why you're doing this work. Then it helps get through that point. And I will use the experience of working at the White House as an example because I knew going in that it was going to be for a finite period of time. And there's pretty large turnover at that level because people get burnt out. It's really very hard hours and hard work. And, you are essentially making that your top priority. But the way that I got through it was that I knew that this amazing opportunity, this privilege of working at the White House was not going to be forever. And so to go in to be appreciative every day, regardless of how hard it is or how much I wanted to go and cry in the bathroom, right? Like it didn't
Yes,
matter
yes.
because it was going to end one day. And the same can be said for getting through those really hard periods of time is that it's not permanent. We're not going to be in the same space. We're not going to be in the same role. We're not going to be maybe in the same city. I mean, and to the point that we were making earlier where we just never know what life's going to throw our way. To have this mindset of just letting things roll off your back because you know better times are coming is, I think, really, really important. It's taken me years to get to that point, but I do feel like I've learned a lot of really valuable lessons in terms of not being stuck in that, really hard time, but trying to move through it, knowing that better times are ahead.
I think that's so important. And I think, too, also, while you're in those moments, putting some energy towards thinking about the things that you do love about those moments, because those are also fleeting. I had this conversation with Jessie, my associate director in the program we run at Biolosity. We're a small team. We're working really, really hard. And I said to her last week, I was like, okay, we need to pause and remember to have fun. Like we have the opportunity to be a part of all of these medical advances of which we're not going to really have any upside unless it helps us with our future thing. The only upside is being able to help people take things from the lab so it actually gets to the patient, the doctor, and the clinician. And we need to, in this role and in the stage of life, have fun while we're doing it. And I think it's really important for us to remind ourselves and our teams and the people around us that, we should pause sometimes in the moment and just maybe even just have a gratitude in the moment, because it's not that, I have like, you didn't have to work in the White House. You got to, and you took away so
Exactly.
many amazing things.
Absolutely. And I think so I recently heard a talk, this really inspiring talk about if you're having a really hard time or you've come up to this crossroads and you need to make a decision about something and you're really grappling with it, to have a conversation with yourself on your deathbed. So when you're laying on your deathbed, imagine yourself having your present self come to you and ask you this question. How would you respond as you're laying on your deathbed, not knowing how much longer you have to live? How would you respond to that question? How would you respond to that moment in time. I would imagine that most of those conversations include being grateful for the opportunity to even have this experience, even though it's hard, because it's going to make a difference, hopefully, or it will have impact. And when you're on your deathbed, those are the things that you're going to look back upon and be like, I did the right thing, or I made that bold decision and look what it did. And yes, it was hard, but it was the right thing to do. And I think that, to me, that was like, oh, that's a really great way to look at it, kind of pull yourself out of it and look at it from a different perspective. And I think that's a very, very helpful piece of advice as well.
I love that. I'm going to share that. Oftentimes, something similar that I share. Have you ever read the poem The Dash?
I haven't, no.
Okay, so I'll tell you, I have it on my website, a link to it. And I also have in my house, I have a painted sign that says, Live Your Dash. And really, the poem tells about someone who's speaking at a funeral. And he says, on a tombstone, you have two dates, one of celebration when you were born and another one of sadness when you passed away. But what really matters is the dash between and what you did with that dash, which ties to what you're saying. And I harness that a lot when I get frustrated with certain areas. And I think of, okay, well, today, what am I going to do with my dash that I have today
I love that.
I'm going to be grateful for tomorrow? So
Yeah, I love that. I don't know if it's because I'm getting older, but the sense of mortality for me is getting more real. And, I'm not sure if it's because I have aging parents and the idea of them not being on this earth forever, which is what we always assume, is becoming more of a reality for me. But I think, I think being aware of your mortality and knowing that every day really is a gift and we're not guaranteed tomorrow, puts a lot of things in perspective, especially the day-to-day minutia that might get overwhelming or really kind of depressing. I mean, in the reality, in the long run, when we're on our deathbed, is that going to matter? Probably not. So let's just work through it, right? The quicker the better.
Exactly. This leads into my next question. I love bucket lists. So tell me, what's the next bold thing that's on your bucket list, whether it could be personal or professional.
Yeah.
And it maybe is something that scares you a little, but pulls you out a lot. What would that be?
Yeah. Well, I'm actually in the midst of launching my own podcast. It will be called Alpha, because the focus is on women in STEM, and the idea is to give a platform for the first and onlys, right? Women are often the ones who are trailblazing the way forward in so many ways. And I've gone through a long kind of strategy process. I'm not quite there yet at the initiation point, but it's been about a year in the making now, and it terrifies me. I'm so in awe of you and the fact that you are doing this and you're, going into your second season, and I am completely terrified by it. But I do, again, going back to principles and values, supporting women in STEM and giving them a voice and amplifying them has always been something that I have driven towards. And I feel like I'm now at this point where I can dedicate some time and effort to that and really want to be able to use this as a platform to be able to just shine a light on all the amazing women out there doing so many amazing things that a lot of people don't know about but should know about. It's something very different, and it's terrifying, but I'm very, very excited about it at the same time.
Well, I want to encourage you to do it and move forward. The thing I love about a podcast is there are people from all over the globe that watch certain episodes that I'll never get to meet them, but you're going to inspire someone in some other small area of the globe that you're never going to be at. And that person is hopefully going to hear something that inspires the person that's their neighbor or their friend or their relative. So I look forward to subscribing to your podcast.
I will have to have you on.
I would love to be a guest on your podcast. It is a deal. So,
it's a deal.
Okay, are you ready for some rapid fire questions?
I am, yes.
Okay. I want to know what the best and the worst leadership advice you ever received were.
My best has been, as a leader, to always listen to your team's ideas and their voices, and hold the importance of each one, regardless of how senior or how junior they are, right? Everybody who's providing an idea, you should hold that with the utmost importance, regardless of their title or role. If you hear an idea and you're like, uh, you know, don't say anything just yet. Just think about it. Let it sit in your brain for a beat, for a moment, for an hour, for a day, whatever. Because oftentimes when you have the ability to not just brush off ideas because they might be not exactly in alignment with what you were thinking in the picture in your head, doesn't mean
Right.
it's a bad idea. Sometimes it just means that we need some time to really consider it and how it might fit into the broader picture. And I thought that's always been something that I've held on to, because oftentimes, especially as a senior leader, you can brush off things so quickly if they're not in alignment with what you had in your brain. The reason why we have diverse members in a team is to be able to get all those different points of views and ideas as well, right? And so it's up to us to be able to actually infuse them and think about them and deploy them if they make sense in the broader picture as well. That, for me, was the best advice. The worst advice, I think, was putting people on performance reviews without necessarily understanding exactly why they've gotten there in the first place. And I've had people, bosses, put team members on performance reviews without having any idea of why they're struggling or having bad performance. And so that wasn't necessarily advice, but just like, learning by example. In the end, and I think you mentioned this before, it comes down to the people, and being able to
Yes.
understand and have those relationships and those conversations are so critically important, because your work ultimately depends on the people who you surround yourself by. And I think, making sure that we have the best ability to keep those lines of communication open are so critically important.
Amazing. I absolutely agree with that. 1,000%. We rush too fast to some HR process
Right.
versus pausing. And I think actually one thing that I want to double click on that's connecting your best and perhaps your worst is the use of curiosity. So the best is like listening to the people, or listening or sitting with the idea that doesn't immediately resonate. Maybe pause and get curious about why it doesn't resonate with you, right? And the same thing, if you have a team member that's not performing, pause and get curious about why. Talk to the person, understand the mechanism behind, because I think that spirit of curiosity, and also tying back, going to the cultures and to like Uganda and all these different areas, if we can live more in a spirit of curiosity, I believe that the world, including ourselves, is a better place. Okay, let's talk about daily habits. What's a non-negotiable daily habit that you have?
There's two. One is I work out, because I have to, and it's normally in the morning, because if I skip a morning and then I don't, it's hard, at the end of the day, I'm
Yes.
done. I'm not going to work out. But the other is to take this moment when I wake up to have coffee. I'll have coffee in bed, and I'll just like take that moment in just stillness before the day hits, because it will be the only time that I have to really kind of set the intention and the emotional tone for the day. And it's just this moment of pure joy, because there's no crisis yet, and I love drinking coffee in bed, and it's just like this moment that I take in the day just for myself, when as so many of us, once the day starts, those moments never exist again.
I believe it's the moment in time each day where you're fully control of everything around you for that period of time before everything else bombards. And I also
Well,
love coffee in bed as well. I'm a big fan. So, okay. What would you say your personal definition of badass is?
being bold. I think, and this fits in with our entire conversation. I think it's the men and women who sees that something's not right, and does something bold about it. And I think those are the pieces in our life that can really change trajectories and the world that we live in. And to me, those are the people who are really badass, is the ones who are willing to take that first step forward or willing to take the first risk for something. There's no greater badass than that for sure.
Love it. Love it. Okay. So every person on this podcast always provides their favorite motivational quote. Catherine, what is
Yeah.
your favorite motivational quote and why?
Yes, well, will come as no surprise. It is by Nelson Mandela, and it seems impossible until it's done. And I think it goes towards the core of, you have to take that first step, right? It always seems daunting and we don't know how it's going to unfold, but if you don't take that first step, it will never happen. That to me has always been a driving, motivating quote for me.
I love you also bringing Nelson Mandela into this conversation. He's universally recognized as one of the the greatest leaders of all time.
Yes.
And the leadership model that he just exuded onto the world is just so amazing and admirable. So I'm so glad you brought him into this conversation.
Yeah. Yes, he certainly made a huge impact in my life, and he's somebody that I will forever look up to for sure.
Amazing. Okay, so tell the listeners how they can find out more about you and about the work that you're doing.
So easiest way will be on LinkedIn. If anybody wants to connect with me or message, I will always respond. And then about the work that I'm doing, we have a website. It's www.gcf.finance. And that is a website that explains more about the Global Cancer Fund and the platform that we're designing. And there is a way that people can submit their information if they want to stay up to date with the progress that's being made or just to be a part of it in general.
I love it. I love it. Well, Catherine, I know you are seriously busy doing a lot of amazing work, like trying to make a big impact on the world, on cancer. And so I'm very grateful that you said yes to sharing your story, your wisdom. Is so inspiring. Thanks so much for absolutely bringing some badass to this episode today. I am very grateful.
I'm so grateful for you. Thank you for this opportunity and for having me on. And it was just such a pleasure to meet you. So thank you so much.
Thanks for joining me for today's episode of the Badass Leaders Podcast. To hear more interviews with industry experts and learn how to grow your career in leadership potential, be sure to like, subscribe, and turn on notifications to ensure you do not miss future episodes. This podcast is a production of the AGN Group. To learn more about the AGN Group, visit our website at theagnGroup.com. There, you can discover more about our services, which include hosting workshops, management consulting, brand strategy, keynote speaking, and more. Follow us on all social media channels shown on the screen and displayed in the show notes. And until next week, be brave and be badass.